I'm Dr. Nicholas Chartres. I work at the University of Sydney School of Pharmacy, Faculty of Medicine and Health. I'm a Senior Research Fellow and I study the commercial determinants of health with a focus on chemicals, environmental pollution, including fossil fuels, and also ultra-processed foods. So PFAS chemicals are a class of chemicals that contain 15,000 variants. They're most commonly known for their stain-resistant, waterproof and non-stick properties. Most people know them from the consumer products they have in their house, like a non-stick pan. Teflon pans are the most famous example. Also things like your stain-resistant coating on your couch, and of course things like your waterproof jackets that you'd have in your wardrobes at home. They were made back in the 1950s and 60s, largely by two chemical companies, 3M and DuPont. And they made two very famous, well-known chemicals, PFOA and PFOS. PFOA was used in Teflon pans, and PFOS was used in Scotchgard, but also in firefighting foam. And what's essentially happened is that PFOS has leached into our groundwater, and one of the key characteristics of this chemical is it's highly mobile. So even though it's been used in specific sites in high levels around Australia, it's managed to distribute itself very widely throughout our entire environment, and we now see it in pretty much every single water system. And as scary as this sounds, you and I, or every single person watching this, would have some type of PFAS chemical in their blood right now. So the human health effects of PFAS chemicals has only started to be fully understood in the last 10 to 15 years, and that's because the companies 3M and DuPont that I mentioned before that produced this chemical, manufactured and sold it back in the 1950s and 60s, knew this chemical was hazardous to human health as early as the 1960s through internal studies, and they suppressed the data. And it was only until the early 2000s that the public health community was able to understand the full health impacts of these chemicals. And so over those last 2 decades since we found out, we've been doing studies and basically been playing catch up to understand what the health effects are. PFAS chemicals are a carcinogen. They cause various types of cancer in the body, bladder, breast, testicular, and also affect a range of different endpoints, so neurodevelopmental health endpoints and also reproductive ones as well. The Australian government, since the US Environmental Protection Agency came out with new standards for drinking water in April 2024, have reviewed their own standards and the evidence that was underpinning those standards. And so when these values were released, they were orders of magnitude lower than what the current Australian guidelines are. The US EPA, when they came out in April, said there is no safe level. That's an important thing to understand. They said that once you're exposed to these chemicals, any exposure, your risk goes up incrementally based on the level of exposure. But they set a standard of 4 parts per trillion to say that that is a level that we think that we can reliably test, and also then filter to ensure that the level of risk is at a really low level, and that every jurisdiction in that country had to reach that level in the next 5 years. The Australian government has since come out and they've now revised their standards. They've done their own review of the evidence, which to note was already underway when these US EPA values came out. And they've now said that for PFOA, they're going to move their value from 560 down to 200 parts per trillion, so not 4 parts per trillion like the US EPA. But for PFOS, they've moved it from 70 parts per trillion to be in line with the US EPA's value of 4 parts per trillion. So the NHMRC should be commended for that, because they're aligning with the most recent evaluation by, as I said before, one of the leading authoritative bodies. So there are a couple of critical things that need to be done to ensure that this type of disaster doesn't happen again. And that is to ensure that the companies that produce these chemicals are expected to adhere to the same standards of open access for science and also data sharing as academics are. The second thing, and this is critical, is that before a chemical comes to market, that final study for approval should be conducted by an independent authority that conducts the study through funding from the manufacturer who wants to bring the chemical to market, and that conduct of the study is managed by a government authority like the NHMRC in Australia, or like the NIH in the US. So we need to remove that funding bias from industry, and only then we can be truly certain that the chemicals that are coming to market are absolutely safe for humans to be exposed to.